ask would be absolutely welcome. But we'll talk very briefly, and I want to go through it relatively quickly, and I apologize in the beginning for that because I'd rather have time for Q&A at the end. But we'll talk a little bit about what COVID-19 is, about the vaccines, how they work, what the benefits are, and some of the myths and things that are going around on social media about this, which perhaps is one of the causes of our BAME communities not taking up the vaccine. Next slide, Okay, so what is COVID-19? So you've heard of COVID-19 being knocked about as a name, and the CO of COVID stands for corona, and VI is virus, and D is disease. So coronavirus disease. And the 19 is because the first case was found in 2019. So that's why you hear COVID-19 quite commonly used. Another name is SARS-CoV-2. So in 2003, there was an outbreak. So coronavirus has been around for ages. It's not a new bug. It's been around for thousands of years. And there was quite a bad outbreak of this called severe acute respiratory syndrome in China and a few nearby countries. And from that, you can tell these bugs mainly affect the breathing system. That was in 2003. We had a similar outbreak in the Middle East called MERS in 2012. Now, the current coronavirus bug is kind of a cousin of the 2003 bug. It's mutated a bit, it's changed a bit, and the change has caused it to be very, very contagious. That means it spreads like wildfire, and that's why we're having so many problems about getting all around the world, as opposed to the other two bugs, which kind of stayed relatively close in just to a few countries. There are millions of cases of it. We all know all the stats, and many, many deaths in the UK, around the world, and it's a devastating illness. Our cemeteries are kind of proof to that, aren't they, really? So next slide, please. Next slide, please. There we are, thanks. Back one. There we are, okay. So what we found at the beginning of the COVID-19 outbreak last year, in the UK, there was a point where the doctors and nurses who had died, 94% of them were from ethnic minorities at one point. So it was really seemed to be affecting. There was Indians and Pakistani, Arab people, but it was ethnic minorities dying at much higher rates. Strangely, it was a big concerns for us. And equally, we are finding that it's affecting Black and minority ethnic communities disproportionately, perhaps twice as much as we'd expect. And there may be many reasons, but some of the reasons that we think are, the kind of jobs we do, which are often kind of face-to-face, public-facing jobs. If you have a shop, you're seeing your customers. If you drive a taxi, you've got customers in the back, passengers. Doctors and nurses are seeing patients all the time. So the more you mix with people, the more likely you are to pick up the bug. So that's clearly one cause. The way we live perhaps might be another factor. Often we'll find in our Asian community, certainly I can speak from that side, multi-generations living in the same household. We have grandchildren, and then they have the children and the grandparents in the same house. So they are spreading bugs to each other very easily. We have congregational prayers and other, I'm not saying other people don't, but we do tend to mix quite a lot, checking on each other, checking on relatives and friends. So another reason is probably inequalities. Why do we live in certain areas, and why do we tend to get these particular jobs? I think that's a very big piece of work to be done there, but we think it is a factor. What we're finding is the Asian population also tend to have generally, it's a generalization, worse health. We have more diabetes, we have more heart disease. And when the Asians and the ethnic minority people are picking up this COVID-19 bug, it's making more of them very, very sick. Not all of them, but more of them are ending up in hospital, and unfortunately, more of them we're finding are passing away as well. So it looks like ethnic minorities have the most to benefit from the jab. Unfortunately, we're finding many of them are not taking the jab, and that's a bit of a strange position. And we need to try and work to counter that. Okay, so there's three vaccines that have been licensed in the UK. There's a Pfizer BioNTech vaccine. There's an AstraZeneca Oxford one, and there's Moderna one. Moderna was licensed, I think, last month, and I've not seen it being used in any clinic that I'm aware of, and certainly not in Northwest. So I don't have much experience of it, but it's very similar to the Pfizer one. So Pfizer is the company who made the jab, and BioNTech is kind of the guys who did the research. And the other one's AstraZeneca is the company, Oxford University, where the research was done, hence the name AstraZeneca Oxford, or sometimes they call it AZ. So Pfizer and AZ are the two main ones being used. And they're both as good as each other as far as we're concerned. Whichever you get your hands on, whichever you're offered, I would accept. Okay, so with the Pfizer vaccine, there was a very big trial, 44,000 people. They gave half the people the jab, half the people, like a water injection, no medicine. And they wanted to see what happened to these two groups of 22,000 people. And what they found was after 2 doses, because the full course is 2 doses, about 95% people were protected against becoming very severely ill, against hospitalization, and became more poorly. So it's a very effective vaccine. There's some stuff, some trickiness about how we store it, but that's a bit boring. You don't need to be worried about that. You may have heard with things about DNA and RNA. Well, this vaccine is called an mRNA vaccine. So what does it do? All of these vaccines, or the ones I'm going to talk about today, the coronavirus is a bug. It's got spikes on the surface, and it looks like a crown. Hence the name corona. Corona comes from crown. So if you see the bug, it's got spiky bits all the way around like a crown. These vaccines do not contain the bug. There's absolutely no virus in these bugs, dead or alive. There's no bug. They have information, genetic information about the spiky bits, the spike protein. They go into your body. Your body then makes defenses against the spike protein. It recognizes the spike protein is not part of me, and I need to attack it. So later in life, in a week or a month or 6 months, when the virus actually comes into your body, you already have defenses ready to attack this virus, at least the spike proteins. Well, the spike proteins attached to the virus, so it's not separate. So when your body recognizes, this is a foreign body, it can then attack it. So you've got defenses already prepared. That's what these vaccines do, and that's how they work. Okay, so the other one was AstraZeneca, a very big trial, again, 23,000 patients over 2 countries. It's between 62 and 90% effective, and there's a bit more science in that. It's a bit more complicated, but essentially they're both very, very good. Your normal flu jab is 50 to 60% effective. So these are way better than that, actually. So it's actually remarkable that they made them so efficient in such a short time. Again, 2 doses. This is a DNA vaccine. Okay, slightly different to the other one, but again, similar kind of genetic method of making the vaccine. And again, they make defenses against the spike proteins ready in your body for the bug to come along in the future, so you can attack it quite efficiently. And that's one of the reasons that you don't tend to become so unwell. Now that's a little bit of a boring, it might be too complicated, so I don't want to go into it too much, but essentially what it's showing is that's how the AstraZeneca jab works. They get a dead, an inactive virus bug from a chimpanzee. So it's not chimpanzee itself, it's a virus, like a flu type bug that affects chimpanzees. It's still a bug. It's nothing to do with the chimpanzee itself, but it doesn't tend to affect human beings. So they get one of those bugs, they make some modifications and put that spike protein information into the virus, and that's injected into the body. Your body then eventually makes, after a few steps, makes defenses. Yeah. Now that's the AstraZeneca one. The Pfizer one follows a very similar pattern, but can you see that kind of number 8, like a sky blue number 8 in the middle of the cell with a next to cytoplasm? Yeah. Yeah, that's it. The Pfizer vaccine starts there, whereas the AZ one has a couple of steps before it. It doesn't make any difference to you and I. Ultimately, it leads to defenses in the same manner, but it's just, if you want to be technical, there's a couple of steps on the AstraZeneca before the Pfizer one, but they do exactly the same job. Moderna, as I said before, is very similar to Pfizer. It's a mRNA vaccine. I have no experience of it. I don't know anybody who has in the UK, but it's supposed to be very effective as well. We may see some rollout in the future. Okay, so in the UK, the MHRA, they are the ones who have signed these vaccines off to say they're safe. Now, the MHRA, the Medicines Healthcare Products Regulatory Agency, they also have signed off your and my tetanus vaccines and the baby jabs we give and the Hajj vaccines. The same people who have said they are safe are saying the COVID vaccines are safe. So that's really important. If we trust them from the majority of the vaccines we have, there really isn't a reason to not trust them on this one. You will know that there was a rollout of the vaccines. First, the 80 plus year old people got the vaccine, and then went to 75s and etc. People in nursing homes. There's a system to who's getting the vaccine, and this company, this government organization, the JCVI, they decided on the who gets the vaccine first. That's all. That's what the information is there for. And of course, many fatwas, lots of Muslim countries are using this, many fatwas from the UK and outside who say that the vaccine is safe to use. Okay, so COVID-19 vaccine. So as I said before, because you make these defenses in your body already pre-prepared, if the vaccine, the virus comes into your body, you don't become so ill. You don't get the coughing stage and the feverish stage. The vast majority of patients didn't get to that stage, therefore you're less likely to spread it. So first of all, you protect yourself by not becoming very unwell. You don't end up in hospital, or you're less likely to, and of course then that leads to less likely to pass away. So that's your own protection. Secondly, because you're not coughing, so the main way we're spreading this is touching and coughing, well, then you don't become so unwell, so you're less likely to spread. Now, in our communities, there are people who can't have the vaccine. For example, at the moment, pregnant women generally are not being given the vaccine. There might be some exception, but generally speaking, we're not using on them. But by you having the vaccine, you're kind of protecting them by not spreading it to them. So you protect yourself, you protect your families, you protect the communities. It's really, really important. And I think that's why I think it's a very important thing to do. You can also develop some immunity by, but if we came across any bug, your body does create defenses against that. But it's a very risky business, because how many people are we seeing who are becoming very ill, long COVID, you're seeing being very poorly for many, many months and even dying? And also that the effect on the healthcare system, can we afford that to happen? It's a very, very high risk game if you think, well, we'll just all get ill and eventually we'll get defenses. Yes, that might be the case, but not everybody's going to survive that. And also the exposure might only give you temporary immunity. We've heard about new strains. Now, I said to you before, this from the SARS 2003 outbreak to this current COVID-19 outbreak, the difference has been mainly the spreadability, how easily the bug spreads, and this one spreads like wildfire. Unfortunately, these new strains, there's a Brazilian, South African one, they're even more contagious, they're even more spreadable, by up to 50 to 100 times more spreadable. So this is really dangerous stuff. And I think there's some evidence that the vaccines are covering, and they kind of do cover for the new variants as well. Okay, I've had my vaccine. Probably most of the doctors on the call have, and many of you yourselves will have had the vaccine. It can certainly cause a sore arm for 4 or 5 days, maybe up to a week, slight temperature, a bit achy, you feel a bit tired, a bit of a headache. This is no different to any vaccine. Flu jab, travel vaccines, you can get similar problems. So it's no different in that way at all. It's the same kind of needle. It's nothing unusual. Some people feel worse after the second shot rather than first shot, but again, I had my 2 shots and I had a sore arm twice and nothing more. Anaphylaxis is a very severe allergic reaction. And in America, I was on a call with Imam the other day, Brother Imam, and Dr. Naim, he was saying that one of our colleagues, I said, 18 million jabs happened in America last week, up to last week, and only 66 people had a severe allergic reaction. So out of 18 million, 66 is next to nothing, 0.00 something. Is a very, very small number. That it's not impossible, but very unlikely you're going to have a severe reaction. Most people are just getting the minor aches and pains and minor fever. Okay, some of the myths. Is it halal or haram? Well, first of all, it's not really for doctors to say if something is halal or haram. From my understanding, this certainly for the ulama to decide, and most ulama have said in Muslim countries, in the UK, lots of fatwa out there to say it's halal. So we'll take that, and I'm happy to go with that. And you guys will know more about that than us. I personally think there's a bit of an effect. Where did the halal question come from? Because generally, certainly from an Asian background, Asians love injections. They can't get enough of injections. So the fact that they are against an injection made me think, well, why would that be the case? And I think the fact that the recent nasal flu for children that came out, it does have pork kind of extracts in it, ingredients. And I think that's put people on the back foot. So when a new medicine is being questioned, is it halal or not? This one isn't. Has no pork in it at all. But I think it's just the question has been posed because of that, I think. Some people say, I'm young and healthy and I'll fight the bug off myself. And probably that's true. Young people will probably survive mostly. But unfortunately, those young people are going to spread it to their elderly grandfather and the other vulnerable people in their families and society. So it's still not a great idea. Big question. So just go back 1 second, Ina. Some people are complaining that it was manufactured very quickly. So perhaps it's not being made properly. And that's true. It was made very quickly. But there's 2 or 3 good reasons. Number one, SARS came out 2003. So for at least like almost 20 years, there has been work being done on coronaviruses for the last many years, and that work and research helped us to take the next few steps more quickly. So that really saved time. The 44,000 people in the trial and 23,000 people, those people literally came out overnight. And to get people on trials of 100 people, it takes years to gather those people. But I think people were fed up of COVID. They wanted to make a change. They wanted to help, come up with a cure, and they literally came on overnight. So that saved a massive amount of time. And then governments really made big steps to support it with funding and removing barriers where they could. So there's good reasons it was made quickly, not for a bad reason. Actually, a good thing that happened, and we shouldn't be worried about that really. Just go to the next slide, Common questions about microchips. Again, absolutely no evidence of that. People have done research after the vaccine's been made. No one's found any microchips. 5G, the same. There's no evidence of that. Changing your DNA. I think the question probably came up because it's a DNA vaccine, and that word kind of gets in people's minds, and it changes your DNA. It doesn't change your DNA. There's no evidence of that. The trials went on last summer, May, June, July-ish. And, so people have had it for 9 months, and most people from December have had, 15 million, 16 million people in the UK. So there's no evidence of that. Infertility has probably come up from, again, an old story, a myth in, for example, Pakistan, Afghanistan area. People don't take the polio drops because they said they cause infertility. And I think it's kind of stemmed from that. But again, absolutely no evidence of that. People who have had the vaccine last summer and since December have become pregnant, and there's not been an issue so far that we're aware of. So what can we do? As we're doing perhaps today might be a small example of this, and I'm sure you yourselves can do the same, but education, trying to get the correct messages out there. As far as I'm concerned, if somebody makes a decision not to have the vaccine based on the correct information, that's fine. I have no problem with that. What would be an absolute tragedy would be somebody not having the vaccine based on false, stupid rumors and myths, because that could potentially cause someone to lose their life. And I think that's unacceptable. So that's why I think education is key. Building trust in community is important. Some of our Black members of society have certainly, they've expressed from people I know who've done work with them, trust issues. So you've got the Black Lives Matter going on and stuff like that. And then you've got stop and search. You're 9 times more likely to be stopped if you're Black. These things don't help trust. And then all of a sudden, the same people who are perhaps are perceived to be pushing these things are now saying, please take this vaccine and do this, this, and this. And people don't trust that. So that's perhaps bigger than us, but the government level, they need to work on that, I think. There's lots of false fake news and YouTube videos and WhatsApp and stuff, and I think we have to counter that. And I think, at least from AskDoc, we're trying to do some videos to counter that in different languages, and I'm sure yourselves are doing the same. Perhaps if trusted people were to have the vaccines, that might help if they made a little video or said some good words about it. I know of many Imams who have had it, mashallah, and they've said very good words about it and how, it's important to save lives. And I think that has helped. I've certainly had the vaccine. Most of the people, as I say, have had the vaccine too. Ramadan's coming up. Hajj not long after that, maybe this is an opportunity to just encourage people, maybe there'd be a safer tarawih if we're gathering together, safer iftars. If you all had the vaccine, you're less likely to spread it. We could perhaps, this might be an opportunity to use those Ramadan and Hajj, perhaps other events to encourage people to have the vaccine. Other ways might be having a vaccine in more comfortable settings. Like Dr. Imams said, I was involved in a clinic on the weekend in the Jinnah Centre, a local Asian community centre in Bury. And mashallah, we've got a couple of hundred people coming there who wouldn't go to the town hall and the other there's 4 clinics in Bury. They didn't go there, but they came to our clinic. And I'm sure the way we're sitting, language and all that kind of stuff, we covered all those things. And that might have encouraged them as well. Mosques, I believe other mosques are having clinics in the mosque. I know in Cheetham Hill, where I grew up, when I attend the mosque I attend, right next door, there's a clinic. I think that does help. The vegan-friendly issue, I think that's something which the governments really need to consider next time they have a vaccine. They need to be careful on what they order. And redressing health inequalities, that's a big thing to do, but it is, I think, in part of this whole process. Unless we tackle those things, I think this issue may recur in the next big event. I think we have to be conscious of that. Jazakallah. Sorry for kind of whistling through it, but I did want to leave more time for question and answers. Happy to go over anything I've said or any other questions you have. There's lots of questions that I'll let Dr. Inam take over from here. Jazakallah khair.